This is Salam Media, coming to you live from South Africa.
It is 11:35. You are listening to the Mid-Morning Talk on Salam Media. And Wednesdays is our health segment. And today we are taking a look at kidney infection. If you've ever experienced pain in your abdomen, your back, your groin, or side, if you experience nausea or vomiting or other symptoms which we are going to go through, you might have had a kidney infection. So, in order to avoid that, let's learn more about it with our urologist, Dr. Salim Choonara. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Salim, and shukran for joining me.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you, and salam to your viewers as well and listeners.
All right, so Dr. Salim, let's start off first by unpacking what a kidney infection is.
Okay, so an infection of the kidney is when there's an inflammatory process, when there's likely to be some bacteria that has now colonized or affected the kidney tissue, and that gives rise to what we would term a kidney infection. Commonly, obviously presenting with things like pain, like you mentioned, and also fever, especially with the kidney. Often, many people have, because if you consider females, for example, they commonly have infection of the bladder. Doesn't always translate into having fever, but maybe abdominal pain. But in a situation where a bladder infection is not adequately treated, it can progress to a kidney infection. One of the hallmarks of that situation is, people often describe like chills and rigors, that they feel very hot and very cold. So get into a blanket, they don't feel well. Those are what we call rigors or chills, and it's a common feature with kidney infections.
Mm-hmm. All right, so I just mentioned a few symptoms, but what else can we be aware of?
Yeah. So pain is the most predominant feature there. Often it's a signal that your body's giving you that something isn't correct, isn't right, and you need to be checked out. So pain is a predominant one. They can have varying degrees of nausea. I wouldn't say it's entirely common with infection, more common with things like kidney stones, which can present very similar in the initial phase, because the patient will complain of severe flank pain or pain around the kidney area. And they also can have fever, like I mentioned, chills and rigors, and just generally feeling unwell. Especially when you have an infection in your body, you have a general malaise type of feeling, and that can also be a feature. But the hallmarks of a kidney infection are things like fever, chills, rigors, and the pain depending which side of the kidney is involved, either right or left flank pain.
Mm-hmm. Now, who is more at risk of getting a kidney infection, and can it affect anyone, including children under 2?
Yeah. So you touched on two very big groups there. Maybe let's deal with the adults first.
Mm-hmm.
If we had to identify a group amongst individuals that commonly can progress or can develop kidney infection, it would have to be diabetics. They tend to be more at risk for developing kidney type of infections. And often it can happen that they have a bladder infection, like I mentioned earlier. It may not be adequately treated or was not treated, and then that progresses to a kidney infection. That's a common route of how bacteria can go from bladder and then eventually ascend to the kidney and give an infection there. So the diabetics, because they got an immune issue, their immune system is a little bit compromised, it can happen that a simple infection can progress to something more significant like a kidney infection. Then the other big group in that situation would be individuals that have cancer, or those that are on treatment for cancer, especially those that are under chemotherapy, or any of the other immunosuppressive states. Some people are on, for example, high dose of steroids or prednisone, patients who are HIV positive, that are generally immunocompromised. It can happen in those individuals that a simple bladder infection or a urine infection involving the lower urinary tract can easily progress into something where it then involves the kidney. Then, obviously, the other group is those individuals that have things like, let's maybe summarize it to say abnormalities or problems with the anatomy of the urinary tract. So they could, for example, be having strictures of the ureter that can give rise to swelling of the kidney. They could have kidney stones. They could be obstructing the kidney, and that can be, so they can have that anomaly and an associated kidney infection, So I think those are the big adult groups. And then as far as children are concerned, that's a more, I won't say dangerous one, but that's the one that's much more significant, and one has to be more alert and more aware of being able to detect kidney infections in children because of the risk of damage to the kidney long term. Remember, in an adult, they've already gone through the developmental stages, the kidneys are already fully developed. They're more likely to overcome a kidney infection or the insult from a kidney infection than a child will be able to. Because a child's kidney is still developing, it's going through a phase of growth. And in that phase, should they develop an infection, because an infection leads to scar tissue in a child's kidney is more problematic than scar tissue, for example, in an adult kidney. We could just summarize it like that. So that's a group that we always alerted, we're always concerned about, and often our general practitioners and the healthcare workers out there are dealing with children, pediatricians, etc. I think they're also aware of this kind of situation. To have a low threshold to say, look, I think this child's going to have a kidney infection. We need to step up our investigation, or do they require admission? Do they require stronger antibiotics? Do they require further investigation? Not just to sit on it and say, it will pass, because that may lead to problems with the kidney long term.
Now, with the symptoms in children, are they similar to those of the adults, or do they differ a bit?
No, by and large, it will be the similar type of situation. As I said, it will be things like, although remember in the child, let's say for example, someone under 2, they can't always tell you with a lot of certainty and be able to be precisely point out the pain. They may just complain of general abdominal pain, or they're just feeling unwell. They're not eating much. They're just lying in bed all the time. They're not their usual self. They're not playing as they would play, and they may also have a fever as well, which is a very, very important sign in the child. A fever, and they may have some urinary issues. They may have complained about burning when they pass in urine, or they may be scratching the genital area. So remember, they're not going to be able to always articulate very clearly what they're experiencing. It's often the mom or the parents will pick up that my child isn't feeling well, just very lethargic, just very down, not eating, not drinking, scratching their genital area, complaining about pain and itchiness around that area, painful when they pass in urine, or crying when they urinate. So these are some of the subtle changes one needs to pick out, And obviously, once you see a health practitioner, they will do a urine test. They may pick up blood in the urine. They may pick up signs of infection. And the child may have a fever. There may be abdominal pain. There may be tender over the kidney area, what we call the renal angle. Often it will be adults and children. You often find sometimes you go see a doctor and they tap your back, tap your flank area. They're looking for renal angle tenderness, which is one of the hallmarks of a kidney infection.
All right, Dr. Salim, I'd like to talk about the diagnosis of kidney infections, but let us take a quick break and we will continue thereafter.
All for these amazing deals. Quilts from 170 Rand. Private collection standard pillows, twin pack from 80 Rand. Pierre Cardin duvet covers from 250 Rand. Assorted scatters from 100 Rand. We are stockers of Linen House range and designer curtains by Stuart Graham. Let Mates Linen turn your house into a home. Mates Linen branded outlet. 202 Brickfield Road, Overport, Durban. Call us on 031 209 0176.
DusiMed Medicine Depot, Retail Pharmacy and Emergency Medical Depot. Conveniently situated in the DusiMed Medical Center, Corner Burger and Bosel Street, Pietermaritzburg. We provide safe, affordable and convenient medical facilities. Open till 10 p.m. every day of the year. We have a full house clinic that operates from 2 p.m. to 7 p.m., which is run by a qualified sister. The clinic offers immunization, vaccination, wellness, general consultation, and more. Call DusiMed Medicine Depot on 033 3421 DusiMed Medicine Depot, your pharmacy of choice.
As the crisis in Palestine continues, the Africa Muslims Agency teams are on the ground facilitating emergency food and medical assistance to the affected families. Donate 15,000 rand or any amount and help the people of Palestine. Call AMA now on 083-251-9376 or donate online at Africa Muslims Agency.co.za. Africa Muslims Agency, inspiring the spirit of giving.
Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Welcome back. You are listening to the Mid-Morning Talk on Salam Media. It is 11:46. So some symptoms of a kidney infection might include fever, chills, backside or groin pain, abdominal pain, a frequent urination, strong persistent urge to urinate, burning sensation or pain when urinating, nausea and vomiting, pus or blood in your urine. That's hematuria. We spoke about this previously with Dr. Salim Choonara. Urine that smells bad or is cloudy. Those are some of the symptoms and signs that you can be aware of either with you or with your children, because if a kidney infection is not treated, it could lead to something worse. But we're going to find out more about that with Dr. Salim, who is still with us. Dr. Salim, before the break, we were talking about the symptoms and who are at risk of developing a kidney infection. Now, how is it diagnosed?
So you gave a nice summary now in your introduction there about these symptoms. So just a view about, so remember, in any diagnosis in medical science, it kind of follows a pattern. So the first is the history or the symptoms that the patient is complaining about, which you've outlined very nicely in your summary there. Then we go on to investigation, and then that would be part of the clinical examination. So when somebody has a suspected kidney infection, the health practitioner, the doctor, whoever's looking at the child or the adult, will run a series of tests, check the temperature, so you may be able to detect like the fever, for example. When they examine the abdominal area, they may find they may localize the area of abdominal pain or pain. And I mentioned to you about something called renal angle tenderness, where they tap the flank area over the whichever kidney has been affected, and there's tenderness when a doctor would do that. So those are some of the signs. So you've got the history, you've got some of these clinical signs that sort of direct that there may be kidney infection. Then we go on to some of the baseline investigations, which would include things like a simple urine dipstick test. You mentioned about blood in the urine or pus in the urine. It's not always that. It would be a very extreme case where somebody would be urinating pus. I mean, that would be very extreme. And often we see that in patients who have spinal cord injuries, patients with major congenital anomalies of the bladder, etc. Where they trap urine for long periods of time and eventually it becomes pussy. But here, the more common situation would be when the doctor tests the urine with a stick. And when they look at that, they may see evidence of blood in the urine, whether it be visible to the naked eye or only when it's tested. And they may see what we call pus cells, which will be detected on that stick. That now, obviously, we'll say, no, there's definitely something happening here, likely to be an infection. As urologists, when we see our patients, and we obviously do an ultrasound in the rooms as well. So an ultrasound of a kidney that is infected would appear, there would be the periphery or the anatomy of the kidney would be slightly distorted. There may be some stranding, some distortion of the periphery, which would suggest some inflammation. The kidney could also appear obstructed, where there's urine that's been trapped in the kidney now as a result of the infection or a result of a stone or a blockage. It could have been the predisposing factor. So the simple things would be things like your baseline test, like your urine test, and then obviously things like an ultrasound, which would be a very, very basic test to make a diagnosis. Once we think there's something going wrong there, we would then want to identify if there's an actual bacteria in the urine. So that's different now from when someone puts a stick in the urine and test. That's just a very basic test. A more accurate test would be to send a urine sample to the laboratory for what we call MCS, microscopic culture and sensitivity, where they now would look at the urine and find out, is there a specific bacteria that they can culture in that urine? And that also guide the type of treatment that we would then want to institute. Now, remember, often when we get to this situation where someone is in severe pain, they got a fever, it is often the case that we admit the patient. Often that's the case, I wouldn't say 100% of cases, but majority of cases. They would be admitted, and we would start them on a course of intravenous antibiotics. And as the results become available, as the blood tests become available, as these urine analysis become available, depending on what kind of bacteria we find in or not finding in the urine, will determine how we're going to adjust our medication, or our treatment. Now, to the far end of that situation, now remember, we're not going to run the same set of tests in every single patient. You know what I mean? You're going to be guided by the clinician that's treating you. Whether there's a need to do a CT scan, for example. If we think if someone's got stones, for example, or could they be having a blockage of the kidney, or are we considering some anomaly of the kidney? In that case, a CT scan would be appropriate. The next possible investigation would be things like what we call a cystoscopy, where we put a camera into the blood and have a look inside the blood. Is that necessary? Is there a need for it? So again, there's a whole series of tests that can be done, but often you'll be guided by the clinician treating you as to what extent of investigation will be required.
Mm-hmm. All right. And before we get into the treatment, can a kidney infection become something worse if left untreated?
Absolutely. So what it can lead to, which is obviously a concern, and I mentioned about diabetics initially, and we often see this in diabetics. If they have an untreated kidney infection, it often progresses to an abscess, what we call a kidney abscess or a renal abscess, which is dangerous because that can severely damage the kidney, And if it's a very big abscess, it may even require surgery to drain the abscess. Smaller abscesses can be treated with medication. And often, in that particular situation, that kind of patient is one who's going to require a CT scan to make the diagnosis, because ultrasound, it may give you some idea that there could be an abscess there, but ultimately a more advanced investigation, like a CT scan, for example, would detect an abscess. And sometimes we even see situations where there's air or gas forming type of bacteria that are formed in the kidney, and you can start seeing air or gas that's now building up in the kidney. It's very, very dangerous. Often those kind of patients actually end up losing the entire kidney because the infection has progressed to such a point that it has now almost led to fulminant or gas-forming bacteria that has now colonized the kidney tissue, and it literally damages the kidney tissue entirely. And they often end up having the whole kidney removed, So that would be the extreme end of cases, That's not the common situation, but it would be extreme. So to answer the question, yes, left untreated can lead to quite significant abnormalities of the kidney, to the far end where you may require the kidney to be removed. But remember earlier when I mentioned about things like scarring of the kidney. If you think about it, for example, if you have a cut on your hand, as it heals, it forms scar tissue, right? Like a scab that forms on your hand, wherever it may be. Now, a similar kind of process unfolds in the organs in your body. When there's an infection, when there's an inflammatory process, as the body heals itself, it leads to formation of scar tissue, it leads to calcification, deposits forming on the kidney or whichever organ may be involved. And that area that's now scarred, that part of the kidney is not functioning anymore, because remember, that tissue has now died off. That's why it has become hard fibrous tissue. So you lose the function of that particular part of the kidney. So it's a very important area, and the kidney is a very important organ in the global function of the human body, and something we take quite seriously,
Mm-hmm. Well, definitely. I mean, nobody would want to have their kidney removed in the long term. So, if one does get any of the symptoms or see any of the symptoms and think that they might have a kidney infection, they must go and get themselves checked out. Now, take us through the treatment involved.
Okay. So, as I said, you're going to have different degrees of infection. Remember, not everybody is going to come in with a severe infection, but they may have a kidney infection, but it may be mild, So the milder cases can easily get away with antibiotics, Only thing is you require a bit more of a longer course of antibiotics, whereas the conventional antibiotic maybe 3 to 5 days. In somebody where there's a confirmed kidney infection, they may require treatment up to 10, maybe even 2 weeks of antibiotic treatment. Again, the decision will be made by the clinician depending on what the blood and urine test show. So that would be a simple infection, get antibiotics, kidney heals completely, kidney function normal, no problem. The patient probably may never even have a problem ever again with the kidney. That's a simple end of the case. But in addition to that, we may sometimes find situations where someone is not responding well to antibiotic, and that brings into the point I was making early on. So if you have somebody, you can see that they've got other issues, they're not responding to your basic antibodies. You ask yourself, they've got a kidney infection, but could there be something else that's leading that's sort of driving this infection that we're not managing, And common things are things like kidney stones, So, if somebody comes in with a kidney infection, often we do a scan on them to look and see, are we missing a kidney stone, for example, or have they had recurrent infections? They've been treated with antibiotics now over a period of a few months. They have a few months of treatment, they find for a little while, then they get it again, and they get it again. And again, we're asking ourselves, could there be something that we're missing that's on the inside that could be the predisposing factor leading to the infections? Okay, so that would so the treatment now would change now. So they'll be on antibiotics, yes. But for example, let's say there's a stone. Now you have to obviously manage that situation. Remove the stone, break up the stone, whatever it may be. If for example they got a blockage of the kidney, which is the predisposing component, now you need to do something to unblock the kidney. And so forth. So you have to go through a series of investigation, and that will then ultimately inform what kind of treatment this patient is going to get. But to summarize that, the mainstay of treatment for kidney infection would be antibiotics. It would either be oral antibiotics, and more likely to be intravenous antibiotics. Majority of people do recover and they get better. Those that don't respond, the infection can progress, for example, to an abscess. If that happens, the abscess will require maybe further antibiotics or different antibiotics, or it will require drainage to drain out that pus cavity to allow the kidney then to heal. And like I said, to the far end of that situation, a treatment strategy that could be employed would be removal of the entire kidney if it is found that the infection is so widespread it is literally damaged the kidney entirely. But that again is at the extreme. So as I said, depending on what is found by way of investigation in that patient will determine how many treatment modalities will be employed to manage that situation.
Now, I know my mom always tells us to drink a lot of water. I say, drink water, drink water, drink water, especially if your urine is too dark. So, does water help in any way?
Yeah, so that's like I would say old wives' tale, but we all are told, your kidneys need water and keep them hydrated. There's obviously a lot of truth to that, To say that if you drink lots of water, you won't get a kidney infection, that's also not entirely true. Because remember, as I said to you, that there may be certain issues around that individual that's predisposing to getting infections. Because remember, commonly we see people come to our rooms, and even GPs who see this, and again, commonly amongst females, they get a little bit of a bladder infection, something around the period time or outside of that, or related to intimacy, whatever it may be. And those are mild infections. They take a small 3-day antibiotic and they're fine. So that's not the issue we're talking about. But the ones that progress to a kidney infection, there's often something underlying that situation. They've got some underlying factor, some underlying component. So just by drinking water is not going to necessarily get rid of that situation. If, for example, they got a stone, just by drinking water, it's not going to allow something to make the stone disappear. But yes, if we have to say what are we advising in terms of general kidney health, of course, we advise that water intake should be, one should be mindful of that. But it's not to say that if you just drink water, that you'll never get a kidney infection. That's not true.
Yeah, well, actually, the water is not just going to help for the kidneys, but it's going to help for the overall function of the body. So make sure that you drink your water every day, not just for the kidneys, but for your overall well-being. Shukran, Dr. Salim, for your time once again and for your knowledge. Quickly, if people would like to get a hold of you, how can they do so?
Okay, so my room, I'm based at the Mill Park Hospital in Park Town. That's where my rooms are, at the Mill Park Hospital.
All right, shukran, and have a wonderful day. Assalamu alaikum.
Zakara, thank you so much for having me.
That was Dr. Salim Choonara, a urologist, taking us through kidney infections, and you can find him at the Mill Park Hospital in Johannesburg. If you would like to know more, or if you feel like you might have a kidney infection or kidney stones or hematuria, we've actually had some great discussions with Dr. Choonara, which can be found on our Facebook page. And if you have any further comments or questions, please leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. Do stay with us. We will be right back.